Hi, my name is Richard, and I'm here to talk about LVNs, large volume nebulizer. So before entering the patient's room, you would check their charts, look at the doctor's orders and vital trends, recent medical history, anything that would impact the treatment. Um, Afterwards, you would gather your equipment. In this case, it would be a large volume nebulizer with saline, and the bag would usually contain the tubes as well as the water trap and mask just to keep it sanitized. Along with that, I'll have gloves as well as hand sanitizer. The indications for using an LVN is upper airway edema and bypass airways, as well as patients recently extubated. Um, the hazards that could potentially run into would be increased risk of infection because of the condensates, overhydration, as well as bronchial spasms for asthmatic patients. So once we get all the equipment set up in our little table, go ahead and knock on the door.
Yes.
Hi, my name is Richard. I'm a student of the respiratory care program at Hartnell. I'm here to do a treatment for you. First off, may I ask for your name and date of birth?
Scott Sixwadi, March 9th, 1992.
Right, and with that R-bomb, check them, and that's correct. Thank you. So we're going to be doing a humidification treatment for you today. Basically, it's going to apply some humidity to your upper airways, and that will kind of help open up your respiratory tracts a little bit, make it a little bit easier to breathe, reduce some irritations in there. There are some hazards, and they're minimal, and of course we'll be watching you. I don't really anticipate anything, but but it's something you should know. And that there are increased risks for bronchial spasms, just kind of maybe closing up your airways a little bit, and as well as overhydration, a little bit too much water. And again, this is something I don't anticipate, and we'll be watching everything. All right, and we'll be starting off by taking your vitals. We'll be doing your oxygen saturation. Let's go ahead and put this on your index finger. All right, let's put this against your chest. All right, thank you, Scott. May I call you Scott? All right, thank you. So we got a saturation of 98, and your pulse I counted as 40 and half a minute, and it's multiplied by 2, it gets you 80 beats per minute, and your breaths is 10 per 10 and 30 seconds multiplied twice, and that's gets you 20 breaths per minute. So all within normal range. All right, so we're gonna go ahead and set up the nebulizer here for you. So the large volume nebulizer, the doctor ordered 28%, and there's a little cheat sheet back over here, 28%, and it gives you your flow rate that you will be needing. Go ahead and set it up on the flow meter. And in our table, we'll go ahead and grab the first tubing. And then take care not to soil it by dragging on the floor or any soiled linens. There's the water trap. The water trap will be placed in the lowest point, and it'll allow water to collect, condensate to collect from the tubing. Now we have the second tubing. Try not to sort this thing. And on the water trap, there is also a little port. Once this fills with liquid, you can drain it out, and the liquids are always considered a biohazard. Once we get this thing set up, set it the appropriate flow rate. And before putting on the mask, you would check for the mist, and usually put it against a dark background, and you should see a white mist. After that, go ahead and put on the mask. Alright, Scott, I'm going to put this on you. Automatically, you can do it.
Thank you.
Yeah, just put it on.
Okay.
Right over here.
That's gonna have all of this.
Yeah, exactly. And as for the patient's comfort, you just go ahead and adjust the straps and the nose bridge. Make sure they're comfortable. While we're doing that, we go ahead and take the vitals once again. I'll go ahead and take the other. Just switch you back. Thank you. Go ahead and do that. So we've got a pulse of 40 and 30 seconds. That's times 2, that's 80. Breaths of about 8 in 30 seconds. Multiplied by 2, that's just 16. It's within the normal range. So is there, are you comfortable? Is there anything else? The treatment's going to last about 30 to 40 minutes, so I will be stepping out. Do you have any concerns, any questions? Are you understanding everything? Do you have no questions? Okay, all right. Thank you so much. Let me go ahead and just check your upper airway real fast, just to make sure everything's okay. Is it okay if I...
Yeah.
So I'll be going underneath the gown. Just check the upper airway. So we have call buttons on either side, and there's usually a room right over here. If you have any questions, any concerns, something uncomfortable, just go ahead and please call, and we'll come in and I'll come back check on it. And I'll be back in about half an hour just to check on you. So thank you for letting me treat you today. Go ahead and remove gloves. Dispose of it. Sanitize. And normally we'd go ahead and walk out. And outside the patient's room is where we go ahead and do the charting. The assessment is for dyspnea, color. I would go ahead and chart the patient's vitals, the pulse rate, heart rate, and so on. I believe that's it. Thank you for listening.